Hi, everyone. Good morning, good afternoon, wherever in the world you are. Welcome to Systems Change for Childcare, a triple win for families, children, and economies. I'm Susanna Hurd. I'm the Chief Strategy Officer at GHV, and I'm really thrilled that you can join us for what promises to be a very timely conversation about one of the most urgent economic security issues today, and that is the state of childcare globally, including in the US. I want to acknowledge that when we talk about the care economy, childcare is only one form of care in our larger discussion that includes elder care, disability care, and much more. Today, our focus is on childcare. From the convenings at UNGA to the campaign trail in the US election, advocates are on the precipice of change for advancing care policy that will benefit parents, children, workers, and the economy as a whole. As a woman-owned consulting firm, this is a topic that is roots here at GHV. When our CEO, Nejla Elias, founded our firm more than 15 years ago, she did so with the intention of giving consultants the opportunity to do meaningful work and provide excellent service to the partners that we work with while maintaining flexibility in their schedules and their place of work. And this has always meant that our team members with caregiving responsibilities have an easier time, not an easy time, mind you, but an easier one, balancing their home and professional lives. So care is in our DNA, and we take the care crisis seriously and really work to be part of the solution. This webinar is the first in a series that we plan to convene each quarter on issues that GHV is working on. Because we partner with foundations, NGOs, multilaterals, and the private sector, consulting across more than 10 distinct issue areas, we have the privilege of having a very cross-cutting view. We're often positioned as a connector or convener, sometimes among previously siloed partners. And it's from this distinct place that we seek to bring experts across health and development sectors together to advance vital conversations. For today's conversation, we are really honored to welcome our three esteemed panelists. Each brings a distinct point of view on childcare. Bama Athreya, Deputy Assistant Administrator at USAID, Gary Barker, President and CEO of Equimundo, and Reshma Saujani, Founder and CEO of Moms First. We have our panelists' full bios linked in the chat, and we encourage you to check those out and read them. Hopefully you all can access that link. And before we dive into the panel discussion, we'd like to take a moment to frame the conversation around the powerful role that quality childcare can play in shaping our future. Here to provide that framing is Anna Abelson, Engagement Manager at GHV. For almost 4 years, Anna has been consulting with the Gates Foundation's Women's Economic Empowerment team. After Anna's framing, I will moderate the conversation among our panelists, and we'll close out with about 15 minutes for Q&A. Over to you, Anna.
Thanks so much, Suze. So one way to understand how deeply care impacts women is by looking at all of the ways women use their time. That data on women's time use gives us a clear picture of a really gender unequal world. The International Labour Organization, or the ILO, estimates that globally women spend about 272 minutes daily on unpaid care work to men's only 84 minutes. That difference means that women have significantly less time for paid work and less time to spend on their own and their family's well-being. In fact, gender disparity in unpaid care work is one of the biggest hurdles preventing women from fully participating in the labor market. The ILO estimates that worldwide, around 606 million working-age women are either not available for employment or aren't seeking jobs due to those caregiving responsibilities. In comparison, only 41 million men face the same situation. So if we want to create sustainable economic opportunity for women, we have to address those care demands on women's time. When it's affordable, accessible, and of high enough quality, childcare can successfully reduce that time burden for women. But evidence shows that childcare goes beyond just addressing that deficit. It becomes a net positive investment in multiple ways. It drives a country's overall well-being with multidimensional outcomes. Childcare improves women's economic employment and productivity, advances child development, and drives overall growth and well-being. So many of us are here today because we see the potential of investing in childcare. We want to build on that discussion by understanding how to make effective investments. So yes, we're freeing up mothers' time, but a smart childcare infrastructure can create decent jobs and new economic opportunities for paid caregiving. We have a real opportunity to invest in, expand, and formalize an entire industry, largely comprised of women and with little risk for being replaced by AI or new technologies. But as we build that industry, we need to ensure the jobs we're investing in are jobs of quality. Childcare providers need to be supported and paid appropriately. We need to invest in solutions that create dignified jobs with quality training and supports for care workers. But quality childcare also means standards that drive child outcomes. Evidence shows that childcare drives early child development, helping kids build critical skills, preparing them for school, and improving nutrition. These ladder up to things like improved long-term health and expanded future employment opportunities. But designing childcare that drives those sustained outcomes requires change at a structural level. We need to shift the norms and gender roles that drove us to this imbalance in the first place. This isn't just a woman's problem. Sustainable solutions will be driven by systems level change that involve and also benefit everyone. We need investment that reduce women's time burden, yes, but also increase men's time and engagement. Ensuring childcare solutions reach those poor women and families with services that balance this quality and affordability will only happen with government investments. We need to continue to tell the story for policymakers across the spectrum about this overall investment case for care, that these short-term gains will ladder up to a healthier country with long-term benefits. Care is a smart investment for governments with cost-effective models with real return on investments. We're still figuring out that perfect formula to drive these commitments, but it's clear we're moving the needle in a real way and seeing increased momentum. So the evidence on ripple effects is strong. If we invest in childcare, we're investing in women, families, societies, and everyone. We create a more equitable, productive, and prosperous world. And as you said, Suze, we have the benefit of seeing these issues holistically, and it'll take everyone, private sector, government, social norms experts, nonprofits, and economists, to realize the full benefit of this triple dividend for women, children, and economies. We know this is a global problem and requires global solutions. We need to learn from each other and build this shared momentum. So I'm very excited for this discussion with our panelists where we can do some of that shared learning. Back to you, Suze.
Thank you so much, Anna, for framing the conversation for us. Just a note for our audience, we really encourage you to participate in the conversation through the chat. If you'd like to introduce yourself in the chat, we welcome that. We will specifically be looking at the Q&A window if you have questions for our panelists. So we encourage you to use the chat for dialogue with one another, comments, engage in the conversation, and then the Q&A at the bottom in the center of your screen is where you should put in your question specifically for the panelists. Now, I'm really pleased to invite our panelists to join us. Bama, Reshma, Gary, thank you all so much for joining us. We're really thrilled to have you to discuss this vital topic. So I'm going to kick us off with a question for Bama. Bama, looking at the global landscape, what do you see as the most significant new insights or lessons learned from the past 3 years?
Thank you so much, Susan. It's such a great pleasure to be here on International Day of Care. And I guess I want to start just by acknowledging this is the second ever UN commemorated International Day of Care. And I think that's a big part of the answer to the question, what's new in the past 3 years? One of the most important things that's new and that's significant is that we are recognizing and acknowledging care work and the care economy as a really vital part of our national and global economies, economic life. And that was a change, a real sea change that was precipitated by a crisis, the COVID-19 pandemic. A few things that we should just recall. It wasn't that long ago, but we tend to forget just, how dramatic the impacts were on women and girls. The first dramatic impact that I want to remind people of is even though women in 2020 only made up 40% or less than 40% of the global paid labor force, we accounted for more than half of the job losses that occurred during that first year of the COVID-19 pandemic. So women were disproportionately affected by having to drop out of the workforce. Why? Because there was an incredible rise in unpaid care responsibilities. Now, Anna has just reminded us all with a few really, really relevant statistics about the extent to which women disproportionately shoulder that unpaid care burden, the famous double shift, where in addition to any paid economic activity, women worldwide also shoulder several hours a day of unpaid care responsibilities. Well, during COVID-19, that all went up dramatically because children were out of school and needed to be looked after in the home, or their education needed to be supervised because many people were sick and therefore needed extra care. And of course, the folks who were elderly, were older persons, were disproportionately vulnerable to COVID-19 and therefore in extra need of services that would keep them from having to be out in the public domain and perhaps exposed to the disease. So that required a different type of care activities to enable them to continue to live their lives in a way that was safe and avoided unnecessary risks. So for all these reasons, what we saw were a disproportionate effect on women and girls, women dropping out of the workforce, girls being disproportionately pulled out of schools, as there always are when there are additional care responsibilities around the world to care for younger children, to care for the sick, and to care for older persons. So we realized for the first time that we actually did have a huge unpaid resource that was critical to our economies, and that is care. I will say that that galvanized our attention and caused us to start to put some investments behind the need for care infrastructure. And that includes supporting both the need to reduce unpaid care burdens and also to recognize and value paid care workers, because we also realized during COVID-19 just how much we relied on what we then started finally to call essential workers, the essential workforce that provides care for communities. And those workers were all too often, first of all, predominantly women. It's a very heavily feminized workforce when you talk about people providing community-based care services, underpaid, very often in what we call precarious work, which means work with very few protections in place, labor protections or social protections. And sadly, one of the things we saw around the world is increased exposure to violence, that people who actually relied on community healthcare workers, for instance, were acting in ways that expressed frustration and violence toward those very workers on whom they relied. So let me take a minute to say what changed beyond simply recognizing International Day of Care. We started putting some really major investments into care infrastructure. And I know this is a dialogue, so I'll just mention a couple of things quickly, and I hope we'll have a chance to get into more detail about these investments during the back and forth and the Q&A. One really big important investment that we made coming in, the Biden-Harris administration coming in 2021 was to enshrine the attention to care and care infrastructure in our domestic and our international investments. On the international side, which of course is the space where I work, we in 2022 worked with a number of partners, bilateral donor partners and private philanthropies as well, to launch the World Bank's Invest in Childcare initiative. And from the US government side, we made a 5-year, $50 million commitment to this global investment in working with countries around the world to strengthen their care infrastructure. This is only one of many things we did. The 50 million was certainly more than matched by other investments that USAID made, but I'll leave it, I'll turn it back to you and the other panelists for now, and hopefully have a chance to talk a little more about some other exciting investments as we get into this session. Thanks so much.
Great. Thank you so much, Bama. I have many more questions for our panelists, but do want to just, as with our opening question, ask if Reshma or Gary would like to come in with anything additional on what you've seen as the most significant new insights or lessons from the past 3 years. Okay, we're going to jump into our next question. Reshma, when the private sector and policymakers, specifically here, we're talking about kind of at the US national and state levels, begin to invest in care, what seem to be the most promising approaches? What have we learned from those different approaches?
Yeah, I mean, I think the first thing is we've learned that there's no one size fits all test. There's no one solution that works for everyone, and so that there needs to kind of be innovation. And I think the second thing we've learned, particularly now in this election cycle, is that businesses have a role to play because childcare is not number 13 on the list. It's one of the most rising costs of family for families in terms of inflation. It's number one, two, or three. And I think that that has been a sea change in the US this past year, thanks to all the amazing organizations that both Gary and I work with here in the US who've really elevated this issue. You know, to set the stage for those of us, for those of you who may not know, you know, the United States has a broken care system, right? We're the only industrialized nation that doesn't have paid leave. We're the wealthiest nation that puts the least amount of money into childcare. 40% of parents are in debt because of the cost of childcare. For the first time in every single state, the cost of childcare is actually more expensive than the cost of rent and mortgages. And up until now, historically, both the private sector and the public sector have viewed childcare as a personal problem. It is in the terrain of families to fix. It's a nice to have, but not a must. And so at Moms First, we've been really working to kind of change that narrative, not only put childcare in the center stage and pay leave, but prove that it's an economic issue. Families, women cannot work without childcare. And you know, Anna kind of started by talking about how important childcare is for women's labor market participation in particular. And you know, we've always known that at the US, but from a policy perspective, we've kind of pretended like it wasn't true. The first time we really experienced this in the United States was during World War II, right? World War II, all the men had to go back out to work, and suddenly factories were empty, and we said, "Oh my God, what are we going to do? And how are we going? We need women. Women, we need women. Women will save us. But if we need women, well, women need childcare." And so we passed something called the Lanham Act, and for about 90 days, you know, childcare cost every family $1 a day. And it worked. Surprise, surprise, surprise. But again, then the men came back to work and we shut down all those childcare centers and we went back to doing what we were doing before, which quite frankly wasn't working for women. And so we know, we've always known in our bones, right? Historically, like what we need to do. So for years, you know, for the past 3 years, I should say, Moms First has really, our strategy has been to prove, you know, to show that this is an economic issue. And in order to get federal investment, we knew that we needed real buy-in from businesses. So we launched a national coalition for childcare. Now we have over 191 companies, reaching more than 500,000 employees around the country, and we've increased benefits for about 250,000 employees. But despite this progress, I still get asked all the time, well, how do we pay for this? Childcare is so expensive. And so one of the things, again, going back to both Bama and Anna's comments, is there really was a data gap here. We knew intuitively that childcare paid for itself, but we actually didn't have any evidence or any data showing that that was the case. So this past spring, we did a report with the Boston Consulting Group that proved once and for all that childcare paid for itself. And what we found is that no matter the industry or the company size, all companies experience some sort of positive return on their investment in childcare, up to 425%. So whether they had a childcare center on site, whether they were offering backup care, whether they were offering childcare subsidies, they saw a return on its investment. Childcare paid for itself. And they were able to retain, and this is an important statistic, as it took as few as 1% of eligible employees, retaining them to cover the entire cost of childcare. Think about that. They just had to retain 1%, and the entire program, the entire investment of childcare paid for itself. And so what I say is for CEOs to ignore these results, that's financial negligence. So we've proved the case, right? That childcare pays for itself and that it affects their bottom line. And now what we need to do is but private sector investment alone can't solve the problem, can't reach every single worker. We know that we need federal investment. And so, again, I think that this was a bellwether year. I think one, improving the case, in building a coalition of businesses who are going to stand side by side, right? Making both the federal case and the state case for investment.
Great. Thank you so much, Reshma. And want to turn to you, Gary, to see what you might want to add from your perspective, from Equimundo's perspective, to what Reshma has just shared.
Sure. Thanks. Yeah, building on those comments, I mean, I think folks know that Equimundo's remit and mission in this space is how do we engage men to be doing half the hands-on care work and also to be advocating for the care work, so that 200-minute gap that we've got between, or more or less, between how much men do and how much women do, how do we figure out ways that we reduce it? So a couple of thoughts. One, as Reshma cited, we know that investments in care pay for themselves in the private sector. I think it's important to say public sector data finds that too. Partners at ILO have done a whole list of compendium of care policies, and whether it's childcare, paid leave, elder care, other care arrangements, the average return on investment is about 3. So I think we can basically say, hey, public sector, private sector, this pays for itself. This is a good investment. But I think we can't just stop at kind of that rational part, right? It's often male policymakers that we're trying to convince to use that data to, do this as a quote unquote favor for women. I want to go beyond that and say, I want to see men having an investment in it. And I think our data suggests that men do. And so the importance of speaking to male policymakers, as well as men in households across the world, that men want this too. Data that we've carried out for our State of the World's Fathers Report, 17 countries, lower income, middle income. Men also, as Reshma said about the US, of men, all of us prioritizing the need for childcare. Men, in terms of, where men prioritize their policy priorities, it was pretty close to women's across the board. It was access to childcare and leave policies, it was healthcare, and it was family economic well-being. And men want these things too. So I think one is to frame this as, we need men to see our stake in this. In the US, we've seen that about data that we carried out together with the Institute for Women's Policy Research found that 10% of men in the US have had to refinance their houses, their homes, to provide for the cost of care for somebody they had to care for. About 1 in 8 men left their jobs. That's about the same number of women to provide care for a household member. So I think we've got to say, it's not just about men doing a favor here. Men need this. And I think that's a message we need for, again, the men who are ministers of finance and heads of development banks, as we also need men at the household level to basically lean into the fact that men need this, and that men see the benefits for themselves as well as for the benefits that we need for women that are unquestionable.
Yeah, thank you so much. This is clearly a smart investment and a need across the board. Bama, I'm going to turn to you and say that Larry Katz, who is a labor economist and Harvard professor, refers to childcare as a triple dignity investment. So care is a win for families, for childcare providers, and for the economy. What models do you think are building towards this in the Global South, and what are we learning from those approaches?
Great, thanks for this. Also, just want to appreciate the continued, sharing of evidence in both Reshma and Gary's comments on, what happens when you go and actually ask families what they need and where their economic security, is vulnerable, and finding over and over and over again that it is connected to the cost of care. And so when we talk about this triple win, I mean, actually, I've started talking about it as a quadruple win, but you probably could even add dimensions to that. So, I mean, it might help to spell out what that triple win is first, that we've seen from the development evidence that we're collecting, in the countries where we work. And again, I'm sure my fellow panelists will have lots more data to add on the US and in other countries where, where Equimundo works as well. So, the first is, and this I think has been reinforced already, starting with Anna's comments, that if quality, affordable care options exist, that unlocks the potential of women to enter the workforce or to stay in the workforce. I think, Reshma really, you really underscored that, to stay in paid employment, right? So that's one win, is more women contributing to the economy, the overall GDP of nations, because they are in paid employment, and that of course has a multiplier effect. They earn, they spend, right? It goes back into communities, and it rolls up to national GDP as well. So that's one win. The second is early childhood development, that we know that there are lots of really great investments we can make in childcare that expand child's brain development, right? That are bringing best practices in early, and we know that like 80% of children's brain development happens in the first 3 years of life. So it's great to invest in public education, but we actually, like, for the sake of the children, need to also be investing in those early childhood development activities that help parents and families ensure their children get the best possible start in life. And Gary, I always appreciate working with Equimundo because you always remind us this is important to dads too. This isn't just important to moms. And again, we're collecting more and more evidence and data on just how these very simple best practices can be applied, at community levels, even at family levels. And we want investments that bring those best practices to communities and families, and dads want those too, right? We find that as well. And then, the third win that we talk about, I know, is that care workers are an important workforce, and I could say a lot about this, and I might if you give me a chance, right? I had talked a little bit in my earlier framing comments about how very often, if you look at, people who are providing paid childcare, they're in the informal sector, and this is even more true in a lot of the countries where we work. They don't have any sort of sick leave or, any sort of provision for economic shocks once they're laid off. They don't have any access to, to unemployment funds, all sorts of vulnerabilities, daycare workers, the same thing. So, the third part of the triple win that's been described is, if we can create decent work for all these workers who are providing care, they become pillars of support in their families and communities, right? They earn enough to invest back in their communities. So the paid care workforce and the ILO, I think this was mentioned, right? I mean, there's so much room for the ILO has great data, but just how many millions of jobs worldwide we could create by investing in care infrastructure. But let me come quickly to the fourth thing that we're collecting evidence on at USAID, and that is community care workers are not, child care workers include people who, through our programming, certainly, and through other development programming, are working on early nutrition, right? So feeding of children who are involved, particularly vulnerable children in vulnerable situations. They're working on health, just primary health. So a lot of the individuals that provide primary healthcare services to families are informal community healthcare workers, right? They're not clinics. I mean, a lot of places where we work, it's somebody who's just a paid, stipend paid volunteer or an unpaid volunteer who has agreed to take on this role of providing these health services to families. And we call that part of the care economy as well. And so the quadruple win, from the development point of view, is that we're actually creating more health resilience in communities by investing in care. So again, lots to say about, exactly what we're doing here, but let me turn it back to you and to the rest of the panel.
Absolutely. Thank you so much for highlighting that sort of fourth win when we think about the benefits and the value of this investment. Gary, I'd like to turn back to you and ask you what you think are the key social norms that really impact childcare. So how do they impact factors like impact, uptake, and sustainability of childcare programs?
Yeah, I'll probably comment more on the norms related to the gendered aspect of it, right? Which is, I mean, certainly there's norms related to, are we okay in societies that, are believe that women's work is to take care of children is probably the single one that gets in our way, right? Do we want to devote resources to this? So, I think at the top of this is, do we believe in the full equality of women and girls? When it comes to care overall, I mean, we certainly see just how much we segregate this notion that women care about care and men care about the other things in our economy. So I think we put that at the top of our list, that time gap, right, that we continue to consider that care work is women's work continues to perpetuate, and it pays forward. And it means that both men and women continue to think, even if I have access to care, the rest of the care continues to be mine. That is women internalizing that idea. So I think one of the norms we've got to look at is that care work is not women's work, it's human work. We all need to do it. We know that norm starts early on, that boys and girls, when we ask them in surveys and these done around the world, girls are much more likely to say, this is normal for me to do, the care for the home, the care for my siblings, than it is for boys to do. And we know those norms play out even when we begin to provide either childcare or paid leave. Countries that have made equal leave for fathers available, even the countries that are the best at this, the Scandinavian countries, men are half as likely to take the full set of days that they are eligible for, and the main reason being social norms. Men are worried if they take the full set of days, their career will fall behind. To which we like to say to men, well, welcome to what women have experienced for decades, which is the reason that you also need to take your days, because then we're all in this together. And the other challenge, I think, is that we continue to see the care professions as women professions. About 75% of paid care workers, whether in childcare, elder care, or the healthcare professions across the world, are women. That number has proven extremely sticky over the last 20 or 30 years. And it's also important to mention that although women are the vast majority of that workforce, they're only 25% of the senior positions there, where we in fact see no problem with men kind of rising to the top. So I think that's another normative issue that we've got to think about as well. There's one data point from the US that finds there's more women flying military planes than there are men kindergarten teachers in the US. So just to give one sort of very clear example of that normative issue that we think care is something that women do. And so I think that then kind of has the knock-on effects to childcare. We think women care about it. We think it's a women's issue, instead of saying, hey, we need actually men to invest in this. Part of the issue in terms of the care workforce and seeing, how we professionalize it, pay it better, because I think that's another point we have to talk about, is that we don't consider it to be a second-class profession that is underpaid, which is we need more men in the professions, in the care professions. I'd love to see more men and more young men aspiring to say care professions are dignified, they pay well, or they should pay well. And I'd like to see, that is where I see a key normative issue, that men aspire to this as a profession, not taking jobs away from women, but adding to the millions of new care profession jobs that we're going to need. And I think if you think about the social norms, to flip it around and say, as we become an aging world, and as there become fewer women in the household to provide that unpaid care, globally, we need more care workers. And if you're looking at, kind of projections of which way economies are growing, to say we need our daughters and sons aspiring to do these jobs that all of us need and that we should treat with the dignity that any job has.
Thank you so much, Gary. And I'm cognizant of time and want to keep us moving along and make sure we have time for questions from our audience. So Reshma, I'm going to turn to you and ask, how can public policy be leveraged to create systems level economic security for families through improved childcare services?
Well, I mean, I think that as we've talked about is like we know that we need the private sector to kind of step up. You know, childcare is a textbook market failure. I mean, someone's written that in the chat. Like it's a it's a broken business model, right? You have a supply side problem and a demand side problem. You know, we don't pay childcare workers enough. 50% of Americans live in childcare deserts. I'm sure that's often the case globally, and so you need the government, quite frankly, to invest. I think the other thing is, and someone else has also written about this in the chat, it is a wildly bipartisan issue. Like 89% of bipartisan voters want their candidates to have a plan. And you know, at Moms First, we tested this out in this election cycle. You know, we worked to kind of elevate childcare from number 13 to 6, and our strategy was to intentionally get it asked as a question. You know what I mean, in the presidential debates. And you know, we had 15,000 moms and allies sign a petition. We advocated for the parents at CNN, and it got asked, and the candidates talked about their golf game, which was great because it pissed everybody off. And then, you know, I, through the grace of God, got an opportunity to ask Trump a question, and I got to ask him about childcare in the Economic Club of New York, where often one does not get asked about childcare. And his answer was not sufficient. And it set off this really firestorm and this incredible public policy debate about how do we fix childcare? Is it a tax credit? Is it a tariff? Is it a subsidy? And for the first time, we were actually really talking about it. And it forced both candidates to introduce that, you know, what they were going to do to fix childcare in their platform. And now they can't stop talking about it. So it just shows what's possible, not just I think from an advocacy perspective, but when there's an issue that most people want a solution on, men and women. And so I think that there's a lot of opportunity, I think, here to continue to elevate, you know, to elevate the issue and to have real solutions that, you know, be put on the table. Because, you know, just to close on this, you know, when the United States was the first country to offer free K through 12 education, and when we did that, people said, "You're crazy. Why would you spend all of that money doing that?" And policymakers said, "Just wait and see. This will make us the most innovative nation in the world." And it did. And it's quite frankly the same thing with childcare. If you take care of your children, if you take care of your elderly, right, that will lead to prosperity. And so I think that we are recognizing that from a business perspective, from a policy perspective, and from, we already know that as parents, you know, that this is what you do, right? But I have a lot of hope for, I think, what is coming.
Thank you so much, Reshma. And I think I'm going to just turn to each of you if you can close out just our kind of panel presentation component of the webinar. What is one thing that our audience members can do to advance the CARE agenda? And Bama, maybe I'll start with you.
Okay, I can't believe we're running out of time already because there's so much to talk about. So I'll answer your question. I do just want to take a minute to say we've talked big picture, but we can look at real models. Like, people are really doing this stuff. They're doing this stuff here in the US, particularly at at state levels and at municipal levels and around the world. We are supporting such interesting innovations that are addressing the childcare gap, whether it is supporting these really innovative care blocks in Colombia, the country of Colombia, where they're really bringing together a whole range of care services in a centralized location with public support. Whether it is partnering with women-owned small businesses, we're doing that in Kyrgyzstan, right? It's creating actual, business opportunities for women to provide care services for others simply by unlocking access to finance for them to do that, right? So, whether it is public solutions, private solutions, we're working with cooperatives, which frankly, we don't talk enough about. Cooperatives are a huge actual community-based source of care worldwide. So there are things out there. So one thing everyone can do is look for a solution and get behind it. But the other thing, sort of before I open up to the audience, is partner. The other thing we found is we're just starting to talk about this in a really broad multi-stakeholder sense, in multilateral discussions, in discussions with other governments. rather than everybody just doing their own little thing. I mean, because there are a million solutions out there. We need to bring them together, which means we have to partner. So we at USAID have launched a memorandum of understanding with other donor partners. We launched this with Ford Foundation, Care Fund, Avena Foundation, Co-Impact Fund. We are inviting other partners to join so that we can compare notes on what we're doing and have a shared platform where we can look at the data on what's working, the evidence on best practice worldwide, and make sure we are leveraging each other's investments.
Great, thank you so much. Gary, I'll turn to you if you want to leave us before we move into the final segment here on one thing our audience members can do.
Yeah, one would be for the, for the men who are on and the women who work with men and live with men, is tell them to vote like dads. And that's for the US elections and beyond, that if men say they want these policies, let's ask them to vote like dads, legislate like dads, invest like dads, and see our stake in this. That it's the right thing to do in terms of gender equality, it's the right thing to do for our economies, and men can see our stake in this. We get to live longer, we get to be healthier, we get to love better when we embrace our care roles. And so I think not to see the kind of, oh yeah, let's talk with men. As a programmatic approach, I think it's also worth talking about parent training. Particularly in low-income settings, Bama, you mentioned the care blocks in Colombia. One of those aspects included training for dads. Parent training is proven it both reduces violence by men against women, by parents against children, and we get men to do more of the hands-on care work. So kind of investments we can do in the development sector, I would say that's one we need to talk about. But the last, but I'll keep with that one. If you have one thing, basically talk to the men in your life and the men who are here, vote, invest, legislate like dads.
And Reshma, over to you.
Yeah, I'm going to be really quick. I mean, I think to build off Gary, like, don't be afraid to be a single issue voter. Be a care voter. Be a childcare voter, right? We
Yeah.
are so close. I can smell it. We're so close. And I do think the way the United States treats its citizens matters in the rest of the world. If we don't value women's time, if we don't actually if we think that women have to continue to choose between their babies and their dreams, that's or to make them make unconscionable choices between funding their daycare and putting food on the table. If we think that that is okay or decent or just, then we're not going to change anything, because people follow us for good or for bad. And so I think it is really, really, really important that we in the United States really figure this out and, quite frankly, learn from other nations who are doing really incredible things as we build our own kind of models here in the US.
Great, thank you. We've got some great questions coming in from folks in our audience. So I will start us off. We know childcare is a good investment and it pays for itself. So why hasn't it happened? Bama, perhaps I'll kick that one to you and then, welcome others to jump in as well.
Oh, I was going to kick that one to Gary first because,
Okay.
I mean, and I'll comment, but I think, your points, Gary, about social norms, right? As they say, culture eats strategy for lunch. Right? Culture is so pervasive and it's hard to break out of things that you're used to, but I might defer this one.
Sorry, I'm going to ask you to repeat the question. I was digging into the Q&A.
They said that
No worries.
why hasn't it happened? And I think, Bama, I think you were alluding to, and I would agree with you, like, I think part of men feel, and particularly now, I think, right, men feel like they've lost status. And so much of men's status is about providing and protection. And so the
Yeah.
place of a woman has been to care for children and to care for children at home. And that has been deeply, 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 I think, baked into American culture. And so I think changing that and shifting that is the powerful work that Gary and his team have been doing, but it's hard.
And add to that, I think it is often hard to look at male leaders as actually empathetic. There's lots of reasons to some male leaders, but I think the other part is to speak to what I kind of ended on before, of how do we speak to male leaders as, you need this too. And I think we have been reticent to engage in men's self-interest in this. When men do more hands-on care of multiple kinds, we're happier, healthier, we live longer. I think reaching into the benefits that men can name, and seeing more male leaders live this and talk about this. We partner with the U.S. Dads Congressional Caucus, 30 members of Congress, all dads. First thing they did was reach out to the Moms Caucus and say, what do we do? Which I think is a really good thing for some men in some spaces, to first talk to the women who have been leading this for decades and say, what should we do together? We've the same conversations with the International Parliamentarians Union, representing parliamentarians from 180 countries, about more than half are men. Also seeing that here's something active I can do for gender equality, and I see the benefit from it. So I think the big policy change is that we've got to do the narrative shift that goes with it. And then the policy changes are not quite as difficult when some men at least see their self-interest in this.
Yeah, I think, Gary, this point is really important. I want to just, one of the things I've noticed is I've had so many more male CEOs who are like, oh my God, my daughter, she
Right?
just graduated with PhD in CS. She just had a baby and she can't find childcare.
Yeah. Yeah.
And so they're so fired up because of their daughters.
Yeah.
It didn't matter when it was their wives, right? But their daughters has like not, and going back to the dad, right? It's like, so I think that there is this point where we have kind of pursued gender equity as like a zero-sum game. And so when we've presented it that way, they're not motivated by the argument that it allows women to fully participate in the labor market, because that means that they lose something. So
Yeah.
one, I think we have to shift that conversation. Two, I think we have to, like you said, meet men where they're at and just recognize that this also affects their bottom line. And they may be motivated by the prosperity of their daughters. Like I definitely felt that at Girls Who Code, right? That was what got people to invest in these programs for STEM. But that's another learning I know I've had. I don't know.
I'm going to add in some more just to layer onto this conversation. And harkening back, I think, Reshma, the anecdote you told about World War II was really telling of just how pervasive social norms are. Even when there was an investment that worked and contributed to the economy, the norms were so pervasive that it was very easy to let the public investment go away. And so we do need to have, there's also some nudge factors that public investment have to do. And one of them, going back to some earlier things that Gary said, are we have to invest in care workers in ways that make those desirable jobs for people of all genders. Because now they're really low paid. There's no, again, no benefits. You don't get sick leave. You don't, other things. But one of the, other stories that comes to mind as we have this discussion is that post World War II, a profession where there were lots and lots of women, was very heavily feminized, was data entry, which was actually data analysis. And you had lots of women, because these were considered secretarial jobs and they were really lowly paid, actually gaining these really tremendous skills for the future economy. And then once the market caught up with the fact that there were specialized skills getting acquired for data analytics, and the salaries started to go up, you saw bingo, this like transition to lots and lots of men pouring into the data analytics sector, right? The computing sector.
Right.
And similarly, there are very specialized skills needed for early childhood development. This is actually stuff that people are underpaid to do, because a really great childcare worker has to have specialized skills. So if we, from a public investment, point of view, started fairly valuing the skills needed, and those became quality jobs with decent salaries, I think we'd see that gender shift in the sector, and the economics would bring the social norms along.
Yeah, Bama, your point's very important because obviously this is my work with Girls Who Code, and like, and you see the pendulum shifting in terms of CS. The world's first program was a woman. These were, weren't very lucrative or respected jobs. Then in the 80s, they become very lucrative and very respected. We push women out. And now we're in this kind of interesting place with AI. So I think to the point about care jobs, that's why it's really important that we pay people really well, right? Because that it's not just about getting men to want to do care work, because they actually do care work when that care work is actually paid well. So it's less about the work and more about the money. And so that is something I think that is an important kind of lesson too, as we again think about these narrative changes, right? In terms of what we're kind of emphasizing.
Maybe I can jump in here is we've got a few additional questions in the chat, which I'm going to read off a few because I think they're quite interlinked and really build on what you all have been speaking about. So the questions that have come through are, how do we effectively shift the idea of universal pre-K to the idea of universal childcare? Is there an example country where government has policies that have worked to address childcare? I know, Reshma, you spoke to this a little bit earlier. And then as advocates, what is the sort of number one or best policy change that we can advocate for from policymakers?
Okay,
Should I
that's a
jump in?
lot all at once.
I
Yeah.
know it is. I know it is.
So I'll just tackle just one like segment of that, right? That is what do we need to do to, show people? We have so much data right now, again, about that first 3 years and just how critical that first 3 years is to the rest of a person's life. That if you get, the right kind of loving, nurturing, caring environment in those first 3 years of life, and the, sort of best practice in early childhood development, you do better in school. Like we have so much data. You do better in school. You have better school outcomes. And then when you have better school outcomes, what happens? You have better employment outcomes, right? Or economic outcomes. So like you have better health outcomes, right? The health determinants, or it's really like dramatic. So wow, we have great data about how much this pays you back and then reduces the need for other types of services, the other support systems later in life, because people thrive. They literally thrive. And for this reason, talking about bipartisan support, in 2020, we had a new piece of legislation called the Global Child Thrive Act that was passed with great bipartisan support by the US Congress that, increased our focus and our investments internationally on those, early childhood years. So one piece of, the answer here is the data is great for the reasons for investing in early childhood development. We have, support and momentum, we have resources, and this is a moment, like this is the moment to make that pivot.
It's going to bring up two country or context specific. One, we could look at Ontario, Canada, which has a massive plan to get to a $10 a day universal pre-K. So, basically putting the finances behind it and figuring out how do you build the infrastructure to make that possible. I would say we also look at Uruguay, which has a national care policy that brings all this stuff together. So part of your question, the question that said, what's the number one? I think Uruguay and Bama, you brought up before, the care blocks in Bogota, I think they've said, you can't do just one, you got to do all this together. Subsidized care, so child and elderly, paid leave, part-time, you've got to have support for part-time workers, that they get the full set of benefits, because we know that usually somebody in the household may have to work part-time for some amount of time. So you've got to have all the policies in place by that. You've got to have the you've got to have the norm change campaigns that go along with it. So we encourage men to do our portion of it. We don't consider it a drag on economies. And I'd say bringing the health sector, the kind of port of entry around prenatal visits and using pregnancy and early childhood to kind of safe and healthy from the start. So I think if anything, to say you can't have one policy, you got to do it as a package. And you've also got to think about equity. So making sure the lowest income households have some kind of either a cash transfer or a subsidy that makes all those benefits available to them. So to those who would say one policy you can't, you got to do 4 or 5.
Reshma, would you like to come in on any of those audience questions?
No, I mean, I think one of the things I've been thinking about as we've been talking too is like, what are the innovative things we're seeing from the private sector? I was just with the CEO of Micron yesterday, who was just an incredible leader, and so thrilled about the childcare center that they built in Boise, Idaho. So because Commerce Secretary Raimondo kind of said, if you want a CHIPS contract, you got to make sure that every worker has childcare. And it's been a really powerful, I think, policy and an incentive. And I think it's also built that sense. I saw it with Sanjay of like, oh, wow, this is a big problem. What else can I do? And I think that that's been really critical. I've also seen more, Amazon's building a big facility in Bethesda, I think. And they're part of that, they're, building, they're the landlords for a childcare center that's not just open to their employees, but everybody in the community. So I'm also seeing more businesses see their role in not just providing a benefit for their employees, but actually solving the childcare desert issue that they're seeing in their community. And I think that those are two real bright spots that I think we need to highlight and shine a light on to encourage more business leaders to do the same.
Thanks so much, Reshma. And on that note, I'm cognizant of time. I know there's so much more to talk about, but I want to really take a moment to thank our panelists, Bama, Gary, Reshma. We're so appreciative for your time and insights and expertise, and for this really robust conversation. We will be sending out a follow-up email with a link to the recording. Encourage folks to please share with colleagues who maybe weren't able to join us today. We will also make sure to get any answers to questions that we didn't have time to get to. Finally, a couple of sort of reminders. If you're in the US, please make your voice heard by voting next Tuesday, or early voting if that's the case in your state. And thank you so much to all of our participants for spending some time with us today on this International Day of Care and Support. We hope you'll join us for our next webinar in Q1 of 2025, and we will be sending out more information on that as details get finalized. But thank you again so much to our panelists and to all of our participants.
Thanks, everyone. What a wonderful conversation.
Thanks, Susanna. Great to see everybody.
Bye-bye, everyone.